Oh, I was wondering if you could introduce yourself and tell us where you work.
Yes, my name is IseladeBaca, and I'm currently working at Centro San Vicente Health Clinic.
And what is your job title and job description?
My job title is I'm a certified health education specialist. My job description is I work under health education coordinator, and my role is to promote a healthful lifestyle through education programs, brief interventions, and act as a resource person for the community.
And you provide these programs for people who attend Centro San Vicente and the area community?
Correct. Oh, actually, all of El Paso.
Oh, okay.
Mhm.
And they all can attend these types of programs
Yes.
at the center? And can you provide a specific example of a project that you've recently worked on and what you did, and so the students have an idea of the types of projects health educators engage in?
Sure. I wrote them down because there's several. I'm assigned to present healthy options to patients with diabetes. We present this through group settings or brief intervention like one-on-one programs. I'm also currently an instructor for the chronic disease self-management program, and that helps patients become empowered to manage their own disease so that they could become empowered and they can take care of, whether it's arthritis, diabetes, anything. I also facilitate and lead the Youth Tobacco Prevention Coalition, and also an instructor for the Texas Youth Tobacco Awareness Program, which is a court-mandated program. So,
Wonderful.
for teens. It's for
Okay.
teens.
And of all the responsibility areas of a health educator, which responsibility area or areas do you practice the most in these projects?
Responsibility number 5 and number 6. We administer health education strategies, interventions, and programs. So we have curriculums that we do present to the community, and we serve as a health education resource person. So we try to become resource people for the community as well.
Wonderful. And can you describe your educational background from undergraduate years to your graduate years?
Okay, I do have my bachelor's in health science and my master's in health promotion. Describe like classes or?
Well, what did you minor in for your bachelor's?
Oh, community health.
Okay, and where did you do your practicum?
I did my practicum at the time it was Texas Department of Health.
Oh, okay.
I did it with.
And what was your thesis on for your master's degree?
Oh, my thesis was, oh my gosh, it was.
And I served on your committee.
I
and
know.
I can't remember.
I know. No, it was the effect of diabetes education on A1C levels in patients in the Hispanic community.
That's right.
Mhm.
And you did it at Centro San Vicente.
Yes, correct.
So you combined your research and your
Yes.
work. That's wonderful. What are some challenges of your job?
Some of the challenges were, and we've talked about this, is making sure you have a job at the end of a grant. That's one of the challenges. We have to make sure, usually grants are probably, a year, 2 years, 3 years. So after the grant is over, that's a challenging one.
And are you on soft money?
Mm-hmm.
And for the students, soft money is grant money that has a beginning, middle, and end, as opposed to hard money, which is a line that
Exactly.
continues on.
Exactly. We've been really fortunate though. I've been at San Vicente for about 7 years.
Wonderful.
Mhm.
Are there any other challenges of your job?
Probably recruitment and retainment of participants in health
Okay.
education programs. Out of like maybe 60 people that we contact, you probably get like 10, 15 back. Don't take it personal.
Okay.
It's just, people sometimes don't really want to know, what's good for them or what's bad for them.
So recruiting participants is challenging. Okay. And conversely, what are some rewards of your job?
Thankfully, there's more rewards than than barriers. I had a list. Having a good relationship with your coworkers. We have a really good, they encourage you, they support you, so it makes it a lot better to go to work. And we each kind of have our own specialty there at the clinic. So that's one of them. Also, when a patient comes in and they tell me that through an education intervention, whether it's a one-on-one, whether it's in the class, that they actually make healthy behavior changes. So when they tell me, oh, my diabetes is controlled now, oh, my cholesterol is controlled, that's a big reward. Also, being able to attend health fairs, going out into the community, being able to attend, what was it? Oh, health conferences. You're able to further your knowledge in the field, and also we're able to join coalitions in the network. network with people and see what everybody else is doing out in the field as well.
Great. You said that you are a certified health education
Yes,
specialist.
correct.
What would you recommend students become CHES certified, and do you have any advice for them in terms of specifically CHES certification?
Oh yeah, definitely study the book.
The review guide?
The review
Okay.
guide, yeah, that helped a lot. But I am CHES certified, and now I know they have the MCHES.
Okay, and did the CHES certification help you in your career?
It was a requirement for my
Oh,
job.
it's a requirement for your job?
For my position, it was.
Oh, okay,
Mhm.
very good. In terms of salary range at your organization or your knowledge just in general, could you give us a range for an entry-level health educator and a more advanced health educator?
Mhm. For entry level, between 28,000 to 30,000, and more advanced, I want to say between 30 and 40.
Okay, very good. And what is your advice in general, besides taking the CHES and passing it, for future health educators?
Pay really close attention in class, because everything that is talked about in class, you definitely implement it in the field. Definitely. Become CHES certified, of course. Try to volunteer in anything that you can. Take advantage of all the research opportunities that are presented to you by your professors, because all of that is going to help you, definitely.
Okay,
Mhm.
and this is a more general question, but in terms of your work, what do you see as future challenges and directions for health education in terms of training and evaluation?
Mhm. The challenge in health education is, since we're under the health education coordinator, we don't do a lot of the evaluation. Usually we have a lot of, with our grants, we have a lot of outside agencies doing the evaluation. So that was one of the things that me and my coordinator had talked about, that maybe we should start implementing more evaluation in our programs.
And doing internal type evaluation?
Exactly.
And how would that benefit your program and your community internal evaluation?
Because we'll have more hands-on on the evaluation and the outcomes, as opposed to somebody else reporting it to us. At least we know how our programs are doing.
And if you detect something, you can make immediate
Exactly.
changes? Oh, okay.
Exactly.
Very good. And I do have one other question. Centro San Vicente, I think, has one of the best models in terms of health educators and promotoras and how they work together. Can you just kind of describe that model for the folks out there?
We do have two promotoras and about 4 or 5 health educators. The way we do it is, the health educators, we're the ones who kind of write the curriculum, and promotoras kind of implement it. But in reality, we kind of work together.
And do you think that's an effective model to serve your community?
It is an effective model. The only thing is, I think that there should be more advocacy for health education, because right now there's a lot of advocacy on community health workers or promotoras. It's a big movement for promotoras, and I really think that there should be more advocacy for health education. I think we're kind of getting pushed a little under the...
So the health educators need to go out and advocate for health and the
Yes.
health education
Yes.
profession.
Yeah, and a lot of my coworkers and I have discussed this, and we're like, we really need to start pushing it and seeing where we could get more health education positions, because they're going kind of towards promotoras and stuff.
Okay, well, that's very interesting. Well, thank you, Isela,
Oh,
for
you're
your
welcome.
time, and we appreciate your efforts in the community as well.
Thank you, I appreciate it too.
Thank
Thanks.
you.